So good morning, and it's wonderful to join you here today. As you all know, we have a lot of work to do when it comes to health literacy. Health literacy skills are used every day and are necessary to be able to make decisions about one's own health and well-being, act on appointments, procedures, medication and treatment, to make lifestyle choices that support good health and exercise good care rights. Despite being crucial for everyday life, we know that most Australians have poor health literacy, with around 60% of us not having enough health literacy to make optimum health decisions. We also know that certain socioeconomic and cultural factors influence health literacy, with individuals and communities with a lower socioeconomic status and who have a disability, who live in rural and remote areas, are Aboriginal or are from a culturally, linguistically diverse background, are more likely to have lower health literacy. We know that older people are also at higher risk of low health literacy, with around 80% of older Australians reporting low health literacy. If people are not health literate, we need to know that they're more likely to have poor health outcomes. It's Monday morning, I do apologise. And that's something that we need to address. Examples of these impacts include poor knowledge and understanding of medical conditions, including their preventability, increased hospitalisations, adverse events, and culturally and racially mediated inequalities in health outcomes, fragmented access to care, reduced use of health services, management of chronic conditions, medication errors, misdiagnosis due to poor communication between providers and patients, low rates of guidance and treatment compliance, hospital readmissions, unnecessary emergency room presentations, and higher mortality, high incidence of chronic disease conditions such as diabetes, cardiac arrest and stroke. So all these things are very important, that we have to address these things so that we can use our system more efficiently and that we can ensure that people are getting the health outcomes that they need. An Australian study found that people with inadequate or low functional health literacy are more likely to report having diabetes, cardiac disease and stroke, and less likely to have recently seen their doctor. And that's for a number of reasons. People who are unwell and have low health literacy may not know to seek medical attention for certain symptoms. People who are unwell and see a GP for primary healthcare professionals may not know how to seek follow-up care or understand how to take their medication correctly or follow the health recommendations of their doctor. People with low health literacy can struggle to sort through the masses of information out there and may disengage altogether from making choices that would improve their health. And I think that to a certain degree, all of us are guilty of this. We've all been told by our doctors or been given advice that we just haven't taken. I know I'm currently struggling with a few health bits and pieces. I've actually lost 8 kilos since Christmas this year, so working on trying to reduce the weight. Got a fair way to go though before I get back to a healthy weight, but certainly being able to work on that is something that we should all be aiming for, and be giving people of different backgrounds every opportunity to also make those decisions. But also, how many times have you watched the news or heard that red wine is good for you? I've certainly tried that out. And it seems like chocolate is good one week and bad the next, and I'm firmly in the good camp on that particular issue. But you just don't know what information to believe, and that's why it's important that we provide the correct information to people in the community. Given that Victoria's growing and ageing population and there is a rising prevalence of chronic disease, we need to act now to improve health literacy and help more people make the best out of our world-class services that we have available here in Victoria. We know that people have better health outcomes if they attend appointments with their healthcare professionals, if they take their medication correctly and follow the advice of those professionals. We also know that raising health literacy even will improve the efficiency and sustainability of our health sector, because if people are following the medical advice that they are given and seeking regular primary care, they are much less likely to end up requiring acute hospital care, which is something that we prefer. But also it is for the best interests of our patients. No one wants to be ill enough to be in hospital because the food's atrocious most of the time. But improving health literacy empowers people to become more involved in their own healthcare, to make informed decisions about their health and to act on these decisions. But that work cannot be done in isolation, and that is why this project is so commendable. We know people rely on healthcare professionals for information and advice. That trust is built up over years of treatment at local health services. Health professionals need to learn how to become great communicators and involve their patients in the healthcare decision-making process. By supporting our healthcare professionals to boost health literacy, this course will pay dividends for patients and staff relationships for years to come. The Victorian Coalition Government also supports this work, and we recognise that successful partnering at all levels is crucial to the vitality and growth of the Victorian health system. This course is an example of academics, government and health services working in partnership to improve health outcomes for Victorians. The Victorian Government is committed to empowering people to maintain their health and make informed choices about the most appropriate health care that they need. Improving health literacy is central to this commitment, and the Victorian Health Priorities Framework 2012-2022 identified that improving health literacy for Victorians is fundamental for better health outcomes and improve access to a range of programs to maintain good health. Other recent work undertaken by the Department of Health includes the Victorian Quality Council reproduced the Talking with Your Doctor, a guide for older people to better suit an Australian audience. The development and distribution of the Australian Charter of Healthcare Rights in Victoria, which promotes the rights of patients, consumers and family members using the Victorian healthcare system. It can be ordered in English, Easy English, and 25 other community languages, and is available in Braille and also an audio file. A range of other work is being carried out at a state level, and also nationally, but I want to acknowledge how important local activities like this one are. Everyone involved in this project should be incredibly proud. You are making a real impact to patients in this rapidly growing diverse community, and your collective work is going to help improve the health and well-being of patients, their families and our whole community. I congratulate everyone involved in putting this course together and those who participated in the first year. And it is my great pleasure, on behalf of the Health Minister, the Honourable David Davis, to launch the evaluation of the Centre for Cultural Ethnicity and Health 2013 Health Literacy Demonstration, almost got there, course report. Thank you.